I'm very grateful for the opportunity to create this video abstract. Our title is Association between the water distribution in the human body and 25-hydroxy vitamin D among the type 2 diabetes mellitus population, a possible pathway between vitamin D and diabetic nephropathy. Here is the background information. Firstly, I will briefly introduce the relationship between vitamin D and type 2 diabetes mellitus. Vitamin D is believed to be associated with type 2 diabetes mellitus and some complications of diabetes, which was confirmed by some previous studies on the associations between vitamin D and type 2 diabetes mellitus, as shown in this table. Similarly, in the second part of the background, we discuss the relationship between water distribution in the human body and type 2 diabetes mellitus. Just like vitamin D, the water distribution indicators of the human body are closely related to type 2 diabetes mellitus. We also made a table to summarize these relationships. Here is a summary of the background. Based on the above background information, we found that vitamin D is associated with type 2 diabetes mellitus complications. Meanwhile, water distribution in the human body is also associated with these complications. Based on this figure, we find two academic gaps. Firstly, no one has ever discussed the possible relationship between vitamin D and water distribution. Secondly, may changing water distribution be one of the mechanisms by which vitamin D affects some complications of type 2 diabetes mellitus? Therefore, our research will focus on these two gaps. Methods and results. 533 patients were finally included in our study. Firstly, we found a negative correlation between extracellular water total body water ratio of the whole body and 25-hydroxy vitamin D levels in two study populations. Secondly, we found the mediation role of extracellular water total body water ratio in the association between vitamin D and diabetic nephropathy. These are the details of our research. All results have been adjusted based on the variables in Table 1. There are two conclusions. Firstly, a low level of vitamin D is associated with a high ECW-TBW ratio of the whole body in the type 2 diabetes mellitus population. Secondly, changing water distribution in the human body may be one of the pathways through which vitamin D affects DN. Thank you.